make sure you take advantage of it. Get outside, enjoy some of this warm, even if it's windy. Now, of course, I'm saying hot, but this morning it was 30-some degrees, so it's a little bit cool at certain times of the day, but take advantage of it still. I was able to go out hiking on Saturday. It was an awesome day to be outside. So one of the things that I wanted to cover today was in our office, we've been busy adding some new services that will be coming on in the next several months. So we're not going to go into great detail with them, but we have a new FDA-approved cold laser for treating pain, inflammation, increasing cellular energy. There's a tremendous amount of different things that we're going to be able to help improve recovery. It's FDA approved for plantar fasciitis pain recovery. That's super exciting. So that actually is sitting in our garage. We might even do an unboxing type video for you on Facebook so you can see behind the scenes when we do that. We also have now into the office this week, we have our oxygen condensers ready for our hyperbaric chambers that'll be coming here in the next 7 to 10 days. And getting that up and rolling, and we've talked about that a little bit along the way too. We've got an additional lumbar decompression chair because it's been so popular in our practice for caring for lumbar disc herniations, bulges, sciatica, low back pain. Been very effective when combined with adjustments in our practice for helping people get over that quicker and stay well longer. So very excited about that. And then a couple of other therapy things too, an interferential and E-stim machine to be able to do therapy while we're on the decompression chair. So constantly improving and changing things in our practice to add more and give you more and more relief. One of the things that's coming up this weekend, of course, is the Minot Marathon and race. And so best of luck to all you runners out there. We are definitely sponsoring that event. So encouraging everybody to have a great time and get outside and enjoy it, like I said earlier. But we also will be actually on site for that on Saturday morning in Burlington. And we will be having our soft wave stem cell tissue regenerative therapy on site and being able to help some of those runners. So as they come across the finish line, if they're having leg pain, if they're having foot pain, if they're having any arm pain or discomfort, we're going to be able to do some of those sessions. So we've got, yeah, I hear you. So if you can excuse me for 1 second, I'm going to grab this. Speaking of new equipment, I just had one of our IT geniuses stop in and help us out. We're having, he's going to be helping us install some patient check-in stations right at our adjusting station. So you'll be excited to see that coming, so he's going to get to work and help us with that. So I was mentioning about the Minot. So if you know anybody that's running and they would like to experience some relief after the run or even feel what this soft wave stem cell tissue regenerative therapy does, certainly look us up. We'll be right at the finish line. We'll be the second one right there. We have that right on site. And stop in there. We're Natalie, and then I believe we're going to have one of our additional team members, Jack, out there as well on that Saturday. So good luck again to all the runners. Thank you to Shields for supporting that. We're certainly a great sponsor of it and excited for that happening too. One of the things that this cold laser I mentioned earlier is fantastic for, of course, is that foot pain that comes along with all those runners. We will not have our laser out there on site. We'll keep that here in the office, but certainly excited to have soft wave. One of the things I wanted to cover today as we get into it is that why do we stop doing something? Why do we quit, or why do we fail at things? And there's a variety of different reasons, but one of the questions that we ask our patients when they come into the office is, what have you done to help this in the past? What's helped? And invariably, we've had people respond that they've had chiropractic care that's helped them, and they've, whether it's been here or somewhere else, generally somewhere else. And we say, well, why did you stop doing that? And a very common answer is they didn't have a plan. They didn't know where they were going, and they didn't know what the next step was. And so when we have raging pain or we have dysfunction, we can't move, it's very clear, right? You want to put the fire out, or at least survive. But beyond survival, it becomes more important that you understand. So one of the reasons that we quit or fail, whether it's exercise, nutrition programs, supplements that we take, is that we don't have a clear plan. We don't have a clear understanding of where we are, where we're going, what the benefits are going to be when we get to that point, and we don't have progress checks along the way. So if we're not seeing progress, if we're not understanding the plan, if we're not seeing it, it doesn't matter whether it's your goal to get fit at the gym, or if it's to help yourself, become a better tennis player or pickleball player. The point is if you're not seeing progress or a way to measure that or a way to assess this or to have a plan to do it, you will have a much higher likelihood of failing. So in our office, one of the things that we do to help our patients continue and reach their goals is to create a personalized care prescription and plan for them. And so what does that mean? Well, there's certain pieces of that we need to meet. And so the first step in the process when people become members of our practice is a health questionnaire course that's very in-depth that helps us understand where they've been, what's worked, and what hasn't. And then upon creating that and then us going through that, we do a nervous system scan, which is most often when our patients come to our practice, they've never had that before. We've had patients that have had chiropractic care for 30, 40 years even, and they've never had their nervous system evaluated by the technology that includes surface EMGs, heart rate variability, then of course infrared thermography for evaluating nerve flow and the balance. So there's so much more I could describe there, but the point is that how is your nervous system doing? Where are you at when you come into our practice? And we can get a clear picture of that from a functional standpoint and also from a visual standpoint so that you can see that. So that's on our first day, is a nervous system evaluation to see where am I at. We certainly use that to track progress, of course. Then we go a little bit deeper than that, even with our exam, putting our hands on a person to evaluate where are things at and how are things functioning. With this thorough exam completed, we do x-rays in our office, digital x-rays, if they're indicated. So here again, we very frequently find things that people didn't realize that they had trouble with prior to coming here because they haven't had digital x-rays. And they haven't had that revealed to them. So that allows us and gives us more information to help prescribe and give you the care that you need and put that into your care recommendations. All of those things coming together help us communicate to you and to our team members what's happening and what the next steps are going to be. So it's important to understand the why that we get adjusted, beyond the pain, of course. And how long is it going to take? So that next step in that process is progress checks so that we have a clear balance. We do scans in our office to evaluate nervous system progress and improvement every 12 adjustments. That allows us then to check in and see, one, we have symptoms that we want to check. Number two, we want to check function. And number three, with movement. And number three, we want to check what's underneath the surface with your nervous system. And that's when we do those three technologies, of course, with surface EMGs, heart rate variability, and infrared thermography, evaluating the function of the autonomic nervous system that addresses all your organs and glands as well as your muscles and your heart rate and all these different things. So we use that as a measure to see, are these adjustments that we're doing and the doctors on our team doing actually helping you? When you can see a progress or you can see a change in your system, you are then more motivated to take care of yourself. It's like I know when I'm exercising and I've exercised 2 or 3 times, I'm more likely then to make good decisions about what I eat. So I can see when I see progress exercising, I make better decisions otherwise in my life. It's the same way when we're taking care of our nervous system. When we see progress going with our nervous system scans, we're more likely to make good lifestyle choices, which of course certainly make you even healthier as you go through. One of the things that we do in our office is evaluate the cervical curve with it. Picture an x-ray from the side of your neck called a lateral cervical neutral that evaluates a forward curve in your neck, which is critical to the slack or the extra motion of your spinal cord. When that cervical curve is reduced or straightened out, it puts tension on that spinal cord. So we evaluate that with virtually every patient that comes to our office because we don't want any spinal cord pressure. So these are just touching on a number of things that we do in our office to evaluate what's happening. Then we have solutions, of course, for helping people do things at home, here in the office to track their progress. But one of the things that's so important to us is that we don't want you to fail. We want you to be successful in taking care of yourself. And certainly we want to help people get out of pain, but that's the first step. It's an awful long life ahead of us, and there's many more things that will come down the pipe from what's right in front of us. So getting people out of their current difficulties, whether it's pain, dysfunction, is step number 1. Understanding if there's any additional ground that can be gained via all these different scans and tests is number 2. And then giving people a very clear picture as to why to continue to take care of yourself and being able to assess that progress and making sure that what we're doing is actually helping you and helping you continue on your path is really what we strive to do in our office. So that personalized, I wanted to outline that. The understanding that where everyone gets the same recommendations or prescription is absolutely not the case. There's so many variables that go into it in our office and our evaluation, like I mentioned, and all those different things, that your system is very different than another's. Your experience is different than another's. The way that you've taken care of yourself over the last 5, 10, 20, 40 years, whatever it happens to be for you, is a big important piece of what we recommend and prescribe for care. Some people need less, some people need more. And certainly that's something that we take into effect with our scans, with our exams, with our x-rays, with the care recommendations that we have all the way through. So your care in our office is very personalized, and that's exactly how it should be. And one of the ways that you get cookie cutter approach, if you will, is or a really lax form of care is if it's all 100% pain based. It's just come and see me when you hurt. Come and see me when you hurt. All we're dealing with is just barely scratching the surface to put out that raging fire, help you to survive. And all of the while when that's happening, there's further degeneration and further problems developing that we don't know about. And so we really work to avoid that in our practice and help you understand why it's the best to take care of yourself beyond that. So if you're looking for a better picture as to why to continue, how to get better and measure your progress, we certainly provide that in our office and do our very best for everyone. We're not perfect, and I've had some people where we've not been able to address or check those things for people, and certain things that come into the play where we've dropped the ball on certain things. But it's really, we've got an amazing team that tracks these things in our office to make sure that we're following through and getting all those questions answered for you and helping you stay on track with your biggest goals. Again, I just want to shout out to the Burley-Mott marathon and race coming up this weekend. Get out and enjoy if you want to watch it. I'm sure you know somebody that's in there. It's a great local event, and we'll be out there sponsoring that. And feel free to stop by if you're out there. And definitely if you've run that race, stop in there. We can help you experience SoftWave and the relief that comes along with that. So keep your ears tuned for all the amazing equipment and things that we have coming into our office through technology to better improve your health, help you live your very best life, and help you stay on that path for the rest of your life. So all the best to you, and good days.